Hi everyone, welcome back to my channel, Dr. Nilani Mind and Medicine YouTube channel. I hope you are all doing well and living a healthy, balanced lifestyle. Thank you so much for your continuous support, for your comments, likes, shares, and advice, and also subscribe my channel. So your encouragement truly means a lot to me. So far we have discussed the cervical regions and thoracic regions. So do you remember, so when I start this spinal cord talking, so I mentioned it, so I have divided into four main part. It is cervical regions and upper back thoracic regions and lower back and lumbar regions and sacrum. So according to that, we already discussed two parts, and today I'm going to talk about the third part, which is the lumbar region. So, as part of my structure approach, I divided into four main parts. The low back pain is one of the most common health problems worldwide. So, globally, millions of people suffer from lumbar spine related pain, affecting work, daily activities, and quality of their life. So around 80% of people will experience low back pain at least once in their lifetime. So it is a leading cause of disability worldwide. So most cases are not life-threatening, but many become chronic due to poor posture. What does the lumbar region do? So functions. So firstly, I will talk about the functions. The lumbar spine is the lower back region. So here, right? And consisting of LY up to L5 vertebrae. So this is the L5, 4, 3, 2, 1. This is the lumbar region. So supporting the weight of the upper body, allowing movements like bending, lifting and twisting and absorbing shock and impact. So protecting nerve roots that travel to the legs. So maintain proper posture and balance a normal shape. So from the side view, the lumbar spine should have a gentle inward curve. So you can see when we side view, so you can see this is the bend, just like a curve, right? Only the lumbar region. So this curve is called lumbar lordosis. The shape is curve or elliptical, not straight. This curve is essential for shock absorptions and spinal health. What is the straight lumbar spine or flat back syndrome? So sometimes MRI or X-ray reports say strengthening of the lumbar spine, loss of lumbar and flattened lumbar curve. And what does this mean? The normal curve is reduced or lost. In some cases, the curve may even reverse. This places abnormal stress on discs, face joint, muscles, and nerves. Why is this not normal? Loss of lumbar lordosis leads to increased pain and also faster degenerations and higher risk of disc bulge or herniations, and also no irritations. So, and next I would like to talk about the signs and symptoms. What patients feel. Common symptoms include low back pain, dull or sharp, stiffness, especially in the morning when you get up in the morning. So you may feel stiffness. Pain when standing, sitting or walking, long period, reduce of flexibility. So muscle tightness or spasm. When nerves are involved, pain radiating into one or both legs. That time it can be nerve irritant or nerves involved, and also numbness or tingling, and also weakness in legs or feet. Actually, most common lumbar spine problem, disc bulge. So you can see that this is the lumbar region, this is the disc, this bulge. So most common problem is disc bulge, disc herniations, and most commonly lumbar 1 and lumbar 5 up to sacrum 1. This area, most commonly lumbar 4, lumbar 5 and sacrum 1. This area mostly affected area when you carry weight, and also can compress nerve root. And next, I would like to talk about the signs and symptoms. What patients feel. Common symptoms include low back pain, dull or sharp, stiffness, especially in the morning when you get up in the morning. So you may feel stiffness. Pain when standing, sitting or walking, long period, reduce or flexibility. So muscle tightness or spasm. When nerves are involved, pain radiating into one or both legs. That time it can be nerve irritating or nerves involved, and also numbness or tingling, and also weakness in legs or feet. Actually, most common lumbar spine problem, disc bulge. So you can see that this is the lumbar region, this is the disc, this bulge. So most common problem is disc bulge, disc herniations, and most commonly lumbar 1 and lumbar 5 up to sacrum 1. This area, most commonly lumbar 4, lumbar 5 and sacrum 1. This area mostly affected area when you carry weight, and also can compress nerve root. Important symptoms is sciatica. So I think so most people may already experience with sciatica, because I have a much experience when I in clinic. So many women, especially in women's, they come for sciatica problem. So pain radiating along the like a sciatic nerve, usually caused by compressions of L4, L5, S1. So as mentioned previously, this area L4, L5 and sacrum 1 also affected for the sciatica nerves. So you may already know the sciatica nerve is our biggest nerve in our body. So in my next video, I will be talking more deeply about the sciatica from my clinical experience. I have noticed that many women are especially affected by sciatica, and I want to explain so its reasons behind this and the best way to address it. And also degenerative changes. So of course, this degenerations, faced joint arthritis, muscle imbalance, and flat back syndrome, loss of natural lumbar curve, so poor posture and so biomechanics. So when is low back pain serious? It is red flags. Most back pain is not dangerous, but urgent medical attention is needed if there is keep remember fever, chills, night sweats, inability to work due to pain or weakness, and progressive numbness or muscle weakness, loss of bowel or bladder control, and sudden severe pain after trauma. So if these are absent, the pain is usually root cause. Why does the problem start? Actually, most people think lumbar problems start only in the lower back. So, but often the problems begins much lower at the feet, maybe chain reactions, foot collapse, poor arch or support, and tibial rotations. This tibial rotations, and also pelvic problem, and pelvic imbalance, and uneven spinal loading, and disc compresses. So this disc compressions and nerve irritations. So some nerve irritations, and trending only the disc treat the symptoms, not the cause. And also corrections. How do we fix a straight lumbar spine? So correction re-injuries, a biomechanical and fascial approach, not just pain relief. So corrections. What are the corrections? How do we fix the problems like a strength lumbar spine? And connection requires a biomechanical and fascial approach, not just pain relief. So corrective strategies include and chiropractic or biomedical corrective care, in office spinal techniques, and also lumbar extensions react. Lumbar direct home tractions device and designed to restore lumbar lordosis, and patients lies over the device and encourages gentle spinal extensions, helps retain spinal shape over time. So connections words best when. So combined with professional care and done consistently, supported by posture corrections, very important. So preventions and protection the lumbar spine. So key prevention strategies: maintain proper sitting and standing posture is very important. Avoid pronounced sittings without breaks. Strengthening core muscles, hip flexions and hip joints. So use proper footwear and foot support is very important. And lift correctly and bench hips, not spine. And also sleep with proper spinal alignment. It's essential. And next, I would like to talk about the key take-home message. Actually, the lumbar spine is the foundation of your movement. Loss of its natural curve is not normal. Pain is a signal, not the root cause. Long-term relief comes from correcting posture and biomechanics and alignment. Early care prevents degenerations and chronic pain. So that's all for today. See you on next week. Thank you for everything.